Welcome to Bradley Hospital. I'm Dr. Laura Ruoff, and I'm the director of the Adolescent Inpatient Unit. We know that having a child admitted to the hospital can be extremely stressful. Our hope in making this video is to address some of the questions and concerns you may have and to introduce you to some of the Adolescent Unit staff. You'll hear how we work together to provide a safe place for our patients, an accurate understanding of the problems that led to hospitalization, and an effective treatment plan. As a hospital devoted exclusively to the care of children and adolescents, we know how critical it is to work closely with families. We have a multidisciplinary treatment team that includes nurses, psychiatrists, pediatricians, nutritionists, psychologists, social workers, speech therapists, milieu therapists, and teachers, all working together to provide the best possible care to each of our patients. Many of our employees have worked here for a very long time and share a strong commitment to the children in our care. We appreciate the time you are taking to watch this video and hope you find it helpful.
As a social worker here at Bradley, we have frequent contact with the families. After a child is admitted to inpatient level of care, one of your main point people will be the social worker. And at that time, it's common for parents to experience a lot of worry because they're leaving their child in the care of a big team of people. And we like to be a person that a parent can call at any time to check in with questions, concerns. We'll also meet frequently to discuss what brought your child into the hospital. What are your worries? What are your concerns? What do you think needs to happen during this hospitalization? We're always moving towards a place of stabilizing the child, stabilizing the family, and moving forward. What will we do after the hospitalization? What disposition plans will we make? Who will your child see when they leave the hospital? Family therapy is an important part of treatment because it's when we discuss what brought a child into the hospital, what the family's concerns are, what the child's concerns are, and we really try to work on assessing the situation and what's going on with your child, but we also try to work on improving communication so that by the time the child leaves the hospital, we'll have plans in place that will hopefully prevent the need for another hospitalization or prevent another crisis like the one that often brings a child to inpatient level of care.
The goals of our program are to create a safe environment for our patients, first of all, and to complete a thorough assessment and put together a very comprehensive treatment program for each patient. We develop our treatment plan on the basis of our assessment, and our assessment is completed really in a very, on the basis of a team approach. So each patient, first of all, sees a pediatrician and has a full physical exam. If there's any concern about any medical problems that may be going on acutely, we may sometimes get some laboratory studies. Each patient has a psychiatrist, a social worker. There's a psychologist that also is able to do some psychological testing. And we do a lot of observation as well of patients on the unit. And based on that assessment, we create an individualized treatment plan for each patient. As the psychiatrist on the team, my role is to lead the team and ensure that the treatment plan is adequately addressing the problems that have been identified in the assessment and to make sure that progress is being made towards those specific goals. The length of a patient's stay depends on the circumstances surrounding the admission and the person's response to treatment, so it's hard to say in general.
Health and safety is the key role that a nurse plays in the care of adolescent patients. So with regards to medication management, monitoring the symptoms and everyday behavior of a patient, as well as overall safety of a patient in the milieu is, I think, the key role that a nurse plays. Every day, parents have continuous contact with their treatment team, whether it's a phone call from a nurse or the social worker or doctor. So whether any changes that we see in a patient, whether it's health-wise, whether it's in their care or behavior, parents are free to call us 24 hours a day, which we tell them from the beginning of treatment, as well as we do check-in calls. Social workers are constantly making calls to parents regarding their treatment. Nurses are constantly calling parents with regards to changes in health, whether it's something they get from playing at the gym and tripping and falling, to something serious like a medication change. So anything that happens with their child, whether it's treatment or health, is being communicated to the parents on a daily basis. From the point of admission, whether it's coming from home, whether a patient's coming from home or from one of the emergency rooms such as Hasbro or in a hospital, we get a full write-up of their medical history. Whether we ask those questions of the parents on admission or we get it from the medical hospital. So if there's something such as asthma or some sort of heart condition or blood pressure condition, as a nurse you're going to get that information right away, and that's immediately implemented within the treatment plan. So if it's constant monitoring, such as with asthma or with blood pressure issues, that's part of the treatment. Every single morning, every single evening, we're going to assess the patient, the child, and we're going to follow that and monitor that patient along with the parents.
We have two main kinds of groups on the adolescent unit. In the morning we have skills groups, and we encourage all patients to participate in skills groups. And the skills that we teach are emotion regulation, anger management, stress management, cognitive behavior therapy, and social skills. And in the afternoon we have a process group, and for process group it's an opportunity for the patients to talk to each other, share their concerns, and give each other feedback. When the treatment team feels like we would like more information about a patient in order to understand what's happening and how we can be helpful, we decide to do some psychological testing with them. And we do psychological tests to assess mood and emotions, personality, and intellectual and cognitive functioning. And this can involve paper and pencil measures, time with a psychologist interviews, or other kinds of tasks. And psychological testing is helpful because it's a quick way to get a lot of information about a patient and get to know them better in a short amount of time. The treatment team decides when patients need individual therapy and may recommend it for patients. Sometimes it's because a patient has a specific issue that therapy can be very helpful with in a short amount of time, such as panic disorder or obsessive compulsive disorder. Other times that a patient might have an individual therapist is if they need a modification to the treatment program for them, if they're having difficulty remaining safe and being successful in the program, and we may create an individual behavior modification program for them to help them.
Child psychiatry residents and fellows who are fully trained medical doctors with 3 to 4 years of experience will be actively involved with your adolescent's care. It's critical that they are part of the team because of the fact that they are so dedicated and interested in learning about child psychiatry, along with the attending psychiatrist, who is the doctor in charge of your child's care. With that team effort, along with the social worker, the outcome for the adolescents is often much better. At Bradley Hospital, we are an active affiliate of the Brown Medical School Department of Psychiatry research team, and on the adolescent program, you and your adolescent might be asked to participate in a research study. Those research studies are never started without your permission. We also ask the assent or get permission from the adolescent to participate. The great value of this is that in the future, Bradley Hospital and the adolescents that we treat will have better outcomes because of the research we're doing.
Working on the adolescent program, you have a lot of different roles, and one of the most important roles, I think, is when a patient comes in, is that you meet them and you try to make them feel comfortable and safe. So when I think about it, that's the first step. When you work from that point on, it's encouraging kids to look at the problems that brought them into the hospital. You're talking about adolescents, so trust becomes a really big issue for adolescents. So working with these patients, you need to be able to hear, you need to be able to listen. They've already had lectures, so you want to listen to what is happening for them and let them know that they will be safe, and as well as everyone else on the unit. A typical day on the adolescent program, the kids start getting up for breakfast. After breakfast, we'll have a meeting that's called Milieu Meeting. When that meeting ends, there's a little bit of leisure time before the next milieu activity, which is run by staff. When that finishes, there's a group that's called Skills Group that will happen, that will take us right into lunch. After lunch, there's a little bit of leisure time. until the next group, which is process group. And when process group is done, the kids will go into an art therapy type group. They'll have another meeting that's a transition meeting to prepare for the evening, and they will then prepare for dinner. After dinner they have a milieu activity, and then they would have gym. After gym they start preparing for the evening, some leisure activity, showers, and then bedtimes. Visiting on the adolescent program can start at 8 a.m. to 8 p.m. Families are encouraged to come in and visit with their kids on the unit. Their parents will be given a unit schedule, and they'll be told which of the activities or the groups are really important for the patients to maybe not be visiting at that time. Parents are still able to select the times that they can come in. If those are the only times they can, we accommodate those times.
We hope this video has helped orient you to our program and answered some of your questions. If you have additional questions, we encourage you to contact the social worker or child psychiatrist who has been assigned to your family. At any time, you can also call the adolescent unit and ask to speak with your child's nurse. You will be receiving a printed parent handbook where you will find more information as well as contact phone numbers for all of the professionals involved in your child's care. Thank you for watching.